We're back. Thank you for staying with us. Dr. Charles Lee is talking about a wonderful, helpful new device for pharmacies to be used in pharmacies called Meducation. Dr. Lee, we were talking during the break, and this also has English. And I'm really tickled because as someone who observes people coming in pharmacies, and the pharmacists at our store, we're an independent pharmacy, we try very hard to be sure that they grasp and know the importance of taking it at certain intervals, the importance of never skipping doses, the importance of just taking it properly in a certain way. And I'm still horrified about your example about a topical something that a person drank because he didn't know any better. I mean, there are real dangers out there, but it's in English, and people not only can access it in the pharmacy if the pharmacy provides this service, but also from home.
Absolutely. And I think one of the things that kind of prompted me to make sure that the English was addressed was about 5 years ago, I happened to develop an episode of bronchitis. I went to my primary care physician, and she prescribed Advair discus inhaler, which is one of these new dry powdered inhalers. And I'm a fairly intelligent guy.
Yeah, of course.
I'm very mechanically oriented. I read the package insert, all the fine print and all the illustrations, and I accidentally took 4 doses. And I'm willing to admit it. So it's not just the language issue. It's just if you're not used to using certain things, you can use it incorrectly. So we wanted to make sure that we have the ability to show people proper techniques and allow them to review those demonstrations from home as well. And also, if any of your audience members have gotten a medication recently, to the outside of the bag, they staple this piece of paper called consumer medication information. And if you've ever looked at it, it's like in 6-point font, and it's really difficult for even for me to read. And
you are a physician.
I'm a physician, and I just turned 45, and I got my first pair of bifocals, and I can appreciate the challenges that the elderly have in reading some of this information. So we need things that are really easy to understand in plain language, at the 5th to 6th grade reading level, in large enough print so that they can actually understand how to use it properly.
And if you had something and you didn't, and you have all the talents and all the skills and all the intellect to bring to it, then that really shows that reinforcement for everybody would be really, really helpful in having much better healthcare outcomes. Well, you brought with you a sample, a video showing us how it works. You want to kind of lead into this? What is the setting? And
yeah, it's a very short summary of how Meducation works. It's just over 3 minutes long, and actually it shows how you can actually access Meducation and how the pharmacist, the several parts within Meducation that they can use, including the ability to speak in the patient's language, the ability to produce written instructions in the patient's language, and to be able to demonstrate complex medications.
And I'm glad about the demonstrate part, because I always like to see it done, and that multiple reinforcement from different mediums is really important too. Let's take a look.
Meducation is a resource designed for healthcare professionals to communicate medication instructions to patients. Meducation can be accessed by going to Meducation.com. Meducation currently supports the following languages: English, Spanish, Korean, Mandarin, Cantonese, Russian, and Arabic, but will grow to support over 30 languages over the next few years. Once a pharmacist signs in, they can do several things: speak phrases to patients who cannot speak English, provide written medication instructions, and show demonstrations. To speak a phrase to a patient, a pharmacist would select phrases from the top bar, select a category, and then click on a phrase.
Do you speak English?
To speak a different language, the pharmacist would select one of the other languages and click on a phrase again.
您是否会说中文?
The folders on the left contain various categories of phrases that a pharmacist may wish to say or ask a patient. To create a written instruction sheet, a pharmacist would select RX Generator from the top bar. Select a medication from our database. Click Start. Select a generic alternative, if applicable. Select the dose. Select the frequency. Select the duration. And then finally, the number of refills. This generates a medication sheet with simple instructions for the patient. Once the sheet is reviewed and accepted by the pharmacist, it can be displayed and then printed in any of the supported languages and given to the patient. For some medications that are difficult to use, Meducation has demonstrations that may be shown to patients. To view a demonstration of Spiriva HandyHaler, for example, select it from the list. Select the language, and then press Start.
The following steps will demonstrate how to use a Spiriva HandyHaler. The HandyHaler is an inhaler that delivers medicine as a very fine powder directly into the lungs where it has its effect. The inhaler looks like this. There are several parts to this inhaler. This is the cover. Opening the cover reveals the mouthpiece. Opening the mouthpiece shows the capsule chamber.
Let's stop this demonstration now. Each demonstration contains information on proper techniques, how to clean and store the device, and additional information for using the medication correctly. To view the demonstration in another language, select a different language and restart the demonstration.
以下步骤将说明 Spiriva HandyHaler 的使用方式。HandyHaler 是吸入器的一种，可以将药物转为即
Once an instruction sheet is provided to patients by the pharmacist, patients may access Meducation from home, review all their medications, and view any available demonstrations, all in their own language.
Dr. Lee, that was very compelling. I can't imagine any pharmacy not benefiting from having that because it does not only relate to people who don't speak English, but for English-speaking people to have the benefit of that reinforcement, to get home and be able to go back through. Often when people, as you and I well know, are getting prescriptions, they don't feel well. They're already in less than ideal circumstances very often, and to comprehend everything about how to take it and how to get the best outcomes at that point is often just not possible.
Absolutely.